Thank you for joining us today for our Midday Makeover segment. I'm joined with a physician assistant from Guthrie, Dan Fascia. Dan, this month, all of March, is National Colorectal Colorectal Cancer Awareness Month. Can you talk a little bit, what that is?
Colorectal Cancer Month is very important to me. A screening colonoscopy can detect polyps so they can be removed before they develop into a cancer. Colonoscopy not only can detect colon cancer, but more importantly, prevent colon cancer.
Okay. And at what age do you guys recommend that people go in to get these colonoscopies, or have this kind of on the radar?
It's a very good question. According to guidelines, average risk individuals should have a screening colonoscopy every 10 years, starting at age 50 up until the age of 74. Patients over the age of 75 who are at average risk do not necessarily need to continue to have screening colonoscopies according to guidelines. It's also important to note that in the African American population, this population should be screened earlier, and the recommendation is 45 years of age.
Great. And as far as getting the colonoscopy procedure done, is that something that's painful, or what should people expect?
No, that is a barrier to colonoscopy in some cases. Colonoscopy is not a painful procedure because it's done in a very private room involving intravenous sedation, so the patient is made very comfortable.
Okay. And you had mentioned, 50,000 people, nearly 50,000 people a year die from this, and then you said this is preventable. Can you talk, a little bit, maybe ways to prevent this type of cancer?
The best way to prevent colon cancer is to follow guidelines and to go for your screening colonoscopies at the recommended starting age, such as age 50, for average risk patients. If you're a high-risk patient, such as a strong family history of colon cancer, personal history of colon polyps or colon cancer, if you have inflammatory bowel disease, or there's some hereditary forms of colon polyps and colon cancer, you should discuss this with your primary care provider or local gastroenterologist.
Great. All right. Well, thank you so much again, Dan, for informing us on such a big topic. And we will post all of this information, as well as places that you can go to get a colonoscopy done, as well on our website WENY.com, and as well as on our Facebook. So thank you again for joining us.
Thank you for having me.
Appreciate it. Thank you.